A neurological examination is a crucial diagnostic tool used by healthcare professionals to assess the functioning of the nervous system. It systematically evaluates various aspects of the neurological system, including the brain, spinal cord, and peripheral nerves. This examination helps diagnose and monitor neurological conditions such as strokes, brain tumors, epilepsy, multiple sclerosis, and nerve injuries. In the neurological exam, the healthcare provider performs multiple tests and assessments to evaluate different aspects of the nervous system. These assessments may include evaluating the patient's mental status, cranial nerves, motor function, sensory function, coordination, reflexes, and gait. Healthcare professionals who use neurological examinations are neurologists, neurosurgeons, primary care physicians, emergency medicine physicians, rehabilitation specialists, nurse practitioners, physician assistants, and medical students and residents. To use our free neurological examination, follow these steps. Download our neurological examination from the Carepatron platform, which you can find in the link in the description. Firstly, the healthcare provider starts by gathering information about the patient's medical history. Next is the mental status examination. This assessment evaluates the patient's cognitive function, memory, attention, language, skills, mood, and behavior. Next is the cranial nerve assessment. The 12 pairs of cranial nerves are examined to assess their function. This involves testing various aspects like visual acuity, extraocular movements, hearing, smell, taste, and facial movement. Next is the motor function evaluation. The provider assesses muscle strength, tone, and coordination by asking the patient to perform specific movements and resistance tests. Next is the sensory function examination. The healthcare provider tests the patient's ability to feel, touch, pain, temperature, and vibration in different body areas. Coordination and balance assessment. The provider evaluates the patient's coordination and balance by conducting tests like finger to nose, heel to shin, and rapidly alternating movements. Reflex testing. The integrity of the reflex arcs is checked by eliciting responses such as knee jerk, ankle jerk, and biceps reflex. Gait examination. The patient's walking pattern and coordination are assessed by observing their gait. The provider looks for abnormalities like limping, imbalance, or difficulty maintaining a steady gait. Throughout their assessment, the healthcare provider may document their findings using a template or form that includes specific areas for each examination aspect. Scoring a neurological examination involves evaluating and assigning numerical or qualitative values to different assessment components. These scores help track changes over time, monitor disease progression, and communicate the assessment findings to other healthcare professionals involved in the patient's care. Here is a sample of our neurological examination, which you can find on our Carepatron platform. To find our neurological examination, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.